You're probably curious if decompression or traction can separate your spine enough to give you relief from your sciatica. Well, I can tell you the short answer to that is yes. And after writing my book and doing the research, we see that traction can actually separate the spine. It's small, but it actually is there. And what we also found is that if you do certain things before or after you do the traction, your results are going to be longer lasting. So what I want to go over with you today is what I've seen work with my clients when they're trying to apply traction to their sciatica, and what you could be doing to elevate that experience to make sure that your results are longer lasting. And then I'm going to show you an easy way that you could be doing traction in your home. But let's go over all of those things because I think it's important to understand what traction is, how much it separates, and what you could be doing for long lasting results. I typically have two types of people that ask me about traction. The first one being acute pain, in that they're going to be crooked, they're going to be offset, they're going to have pain in their back, down their leg, and they're thinking, man, I just need to relieve pressure from my back. I need to get back to work and get back to feeling better as quickly as possible. Will a traction unit decompress my spine enough to allow me to do that? The other type of client that I see is someone who has a little bit more chronic pain. They typically have back pain and glute pain and maybe some intermittent leg pain, and they just want to relieve some pressure off of their back. I've seen both of those clients improve with sciatica, and what we know is that with decompression units, traction units, you can have separation in the spine, but those are the typical clients that I see that are wanting to try traction, and traction does work for both of those. Now let's look at the science here a little bit. I don't know which category you fall in, whether you have more acute pain or chronic pain, but you can benefit from this. And if you're unsure where your pain is coming from, then take my free quiz. It's going to help you figure out, is this more of a bone issue or a disc issue? But what we know by the research is that yes, you can have up to 3 millimeters of change when you do the traction. When you're having a decompression in your spine, yes, there is movement and space improvement in your joints and back, given that you can relax, right? So some of the machines are a little uncomfortable. That's why hanging upside down is not my favorite. I've never found it to be relaxing. Now, there are some clinics in different areas that you could get traction done that have a seated machine where you can have a gentle pull and it will separate your spine. Now, in the research, when I looked at it, we don't know what's best, if it's 1 day a week or 5 days a week. Some clinics did it 5 days a week, even a couple times a day. Now, I'm not sure if they're just doing that for the money or they're actually doing that for improvement in the client. There is no research to say conclusively how much and how often it needs to be done. So we don't know how long, we don't know how often, but what we do know is that if it feels good in the moment and you could feel that decompression, you can have improvement in the pain right when you stand up. You can feel a relaxation in your back, which is great. And that 3 millimeters of improvement is relieving pressure off the nerve and joints, which can absolutely make you move better and feel better. So I'm all about those things. What I'm not all about is that when you go to those clinics and they do those traction units and they have those devices, well, when you look at the research, it says you clearly need to follow that up with mobility exercises, nerve exercises, strengthening. You need to be doing some sort of movement to help support the spine and further remove that inflammation around your nerve. The reason why the decompression works is because it's relieving pressure and the inflammation moves away from it. Well, we know that happens with decompression, but we need to follow it up with the other things. And that's what really gets to me, is that you go to these clinics, they recommend XYZ amount of times and amount of duration, how long you're getting the traction, but you really need to be doing is incorporating things before and after. And so if you need to go for a walk before or after, or doing some stretching or strengthening, those things need to be done. And it's really up to you to figure out what's best for your body. If you're unsure, then you can check out my book, in which I follow up traction and other pain relieving techniques with everything that you need to be doing. And so you can have a good opportunity in a good way to support your spine and to make that traction that much more worthwhile. If those devices are actually separating your spine, which they are, they're not fixing your pain, right? They're not giving you that long-term relief. It is transient. And if we did an image of you before the traction, we did an MRI, looked at the space, and then after the traction, did another MRI and looked at the space, there would be no change in space, and that's okay. But what is not okay is that when you're not following it up with some mobility work or strengthening work. And so I'm going to share with you what I have seen work with a client of mine and how they incorporate traction to provide themselves not only relief in the moment, but long-term relief that's made them successful for a very long time and allowed them to avoid surgery. Let me tell you about a client that I recently had that he used traction every day, but he was able to do it in his home with a technique I'm going to go over here in just a little bit. And he incorporated this technique because he thought he had to buy an expensive unit to put in his house and take up space, but he didn't. With this technique, he was able to do it right when he woke up, right before he did his exercises, and right before he went to bed with very little effort at all. And so he really appreciated having the traction unit to relieve the morning stiffness and pressure, to give him that opportunity and pain relief before he did his exercises, and then end off his day with a relief technique that he could use before he went to bed. And I really liked that because it was completely safe and he was successful with his strengthening and stretching. And so he was getting some therapeutic benefit with some of it, but then he was also just doing some of it because he liked it and it felt good and there's really no overdoing it. And so what was really neat to see him do that is he was able to relax, do the stretching and strengthening after the traction unit, relax during the traction unit, and then do it every day of the week inside his house. So he didn't have to go anywhere, he didn't have to spend a ton of money. But the point of this is that everybody's situation is different. I've seen patients need it 3 times a day. I have seen patients need it 1 time a day. I've seen patients only need it for a couple weeks and then never use it again. Traction is beneficial, and the way that you do it is different for everybody. It does matter what you do before and after, but if you're willing to put in the time and effort and learn what works for your body, it can be really, really helpful. So utilize that traction, just follow your gut. If it seems fishy, it probably is. And I'm gonna go over here in just a second a way that you could be doing traction on your own. You may have seen this in past videos of mine, but it is using the Swiss ball. It's a decompression way. It's a way to decompress, to use gravity to help relax over that ball and pull your spine using gravity. Now, there's nothing wrong with going to the clinic or decompression center to get that traction done. That is okay. And honestly, it's relatively inexpensive, but it is a trip. You know, you have to go there, you have to get it done, you have to come back. And most people are missing the stretching and strengthening component. So if you take anything from this, is that traction does work, but you need to be doing stuff before and after. And whether you figured that out on your own or review my book, either way, you have to be doing something. The research is pretty clear on that. So if you have any questions on that, please leave a comment. But before I waste any more time, we're gonna go over that Swiss ball decompression so you can see what it looks like and I can tell you exactly what it should feel like. Okay, I'm gonna be a little risky here. I'm gonna do the Swiss ball decompression technique on the table. I don't recommend that. Please don't do it on the table, do it on the floor. But just for demonstration purposes, so you can see me and you can understand exactly what you should be feeling. This is a 65 centimeter Swiss ball. I'll put the link in the description. Most people have this. What's great about this technique is that it's cheap. You could do this, and I'm all about cheap, all about being cheap and effective with your time. Most physical therapists are, because I don't feel like you need to go out and buy an expensive unit. Now, you can do that, and I would say maybe there is an incremental improvement when you use a unit that can actually separate you, but in my experience, you get just as much relief if you could just do this correctly on the Swiss ball. So you're gonna use a Swiss ball, 65 centimeters is I found to be the best. I don't care what color, get whatever color you want. So you're gonna go on your hands and knees first. You're gonna put this Swiss ball kind of underneath your belly. Here we go. So underneath your belly, and what you're gonna do here is shimmy your knees back, relax your elbows, relax your head. And what I do is I shimmy forward a little bit right there to feel that pull in my lower back. And where I'm feeling this is right here. Now, some people feel it a little lower, a little higher, but because your arms are dangling and your legs are relaxed, you're able to get that pull from gravity to relax here. Now, remember, in the research, we're not really clear about how long, how often, but like I told you, that client of mine, and most of my clients do this a couple times a day, I recommend about a minute. You don't get that head rush you get with an inversion table. And in my experience, this is comfortable. Now, some of my clients are a little bit proportionally different than I am. And so they have to move some items of their body out of the way to do it, and that's okay. You just do what you gotta do, and then you can relax over the ball that way. And sometimes for a little bonus, I like to take my elbows here. I like to put it into the ball and kind of push this way a little bit, and I get a little bit more traction in my back. The trick is that your body needs to relax. Your back muscles are very strong and very, very firm. And if you can't relax, you're not going to get benefit from this. And so in my clients with disc herniation, stenosis, etc., traction can be helpful. It's not going to be a cure for you, but if you combine it after you do this great distraction techniques here, you're going to pull over. If you combine it with some stretching and strengthening, you're going to be doing just fine. So when my clients are typically starting off with this, I recommend a 1 minute hold on the decompression ball, come out of it, see how you feel. Again, you should have fairly immediate relief and some tension. How long that lasts is really different person to person, but it does take a couple weeks of doing it. We know traction is helpful, but how you do it matters. And so right after that is I would have my clients be doing some stretching and strengthening and mobility work. I'll put a link in the description, or I have a video pop up here of some good exercises you can be doing. If you really want to level it up, check out my book, and it has the Spark program, which is strengthening, pain relief, activating the nerve, regaining mobility, and keeping movement at the center of your recovery. And if you notice, the P is sandwiched between strengthening, P for pain relief, and then activating the nerve is that we're doing some nerve glides, we're doing some strengthening after or before the tractions to take advantage of just prepping your body and getting ready for that movement. So traction can be helpful. If you want to go out to a decompression center or another clinic that has a decompression unit, try it out. But understand, for it, absolutely you need to understand is that if you do anything, you need to be doing some mobility work before, after, or at least walking, something to give your body some relief. So let me know in the comments what traction has worked for you, right? I want to know what units have worked and also how you do it so I can better teach others and I can try it out myself because I love trying new techniques. But as always, guys, I hope you got something from today's video. Do the decompression technique. It doesn't have to be as expensive as you think, but you can do it more often than you think. So try it out. But as always, guys, stay healthy, keep moving, and take care of yourself.